oncology nurse was worried about her patient. A middle-aged man scheduled for a stem cell transplant was experiencing textbook symptoms of a heart attack. Nurse Brown ordered an EKG. When the attending physician, known for his explosive impatience, heard about the patient's chest pain, his response to the EKG results was, "This doesn't concern me," and pushed the report aside, all the while tapping at his smartphone. Nurse Brown knew that if she challenged the doctor's assessment, she would incur the wrath of the doctor. But if she didn't say anything, the patient could die. Nurse Brown decided to challenge the doctor by asking to delay the surgery. At that point, the doctor, a large, imposing man, pushed his face into hers and demanded why to her challenge. It's because of situations like this that at St. Francis Medical Centers, doctors and nurses are on a first-name basis in the operating room. When people use titles to address others, they are unconsciously deferring to the other person. The Mayo Clinic also realizes that debate, conflict, and confrontation are necessary to make optimal decisions, particularly in life or death situations. To foster positive debate, Mayo instituted a program called Plus One that allows nurses or clinical staff to add one person to the patient-doctor-nurse relationship at any time. Most people have been raised to believe that conflict and disagreement are bad and strain relationships. We've been told to get along and go along. However, this approach is really bad advice when it comes to decision-making. Let's distinguish two types of conflict: relationship conflict and task conflict. Relationship conflict is personality-based conflict, and it negatively affects group performance. Task conflict refers to disagreements about the work to be done, not attacks on the people. Task conflict may help group performance. For example, in one study, top management teams in 109 U.S. hospitals with moderate amounts of task conflict were the most effective. However, when improperly handled, task conflict can quickly escalate into relationship conflict. Let's suppose you notice that your team is suffering from relationship conflict. Tensions are high and grudges are being carried. What can you do? Let's use Wagman and Donenfeld's four-pronged approach. Step 1, team redesign. When you first notice conflict and tensions are high, examine the structure of the team. What is the environment like? Are the work tasks equitably distributed? How many people are on the team? Who do they report to? I was on a task force in which tension was high and there was a distinct lack of trust. One member was acting in a passive-aggressive fashion, coming late to meetings and forgetting key documents. As it turns out, he resented the fact that he was in charge of booking the meeting room and copying the documents. He felt that this responsibility was beneath him. We changed that responsibility and the team started to produce. Step 2, team coaching. Sometimes conflict emerges from the norms and meeting style of the team. I was working on a multicultural team in which tension was high, but no one was saying anything. Deeper discovery revealed that some members of the team felt that they were being publicly embarrassed when asked to verbally report their progress. We changed the meeting style by having members submit their reports prior to the meeting and solve the problem. Step 3, conflict skills. Sometimes team members have different experiences with regard to conflict and expressing disagreement. Mary was a student in my class. Prior to joining her current company, Mary had worked at a company in which people felt free to challenge and debate one another openly, but not in an accusatory fashion. However, when Mary joined her new company, she discovered to her dismay a new culture of passive-aggressive silence. So, Mary hired a debate coach to teach her team how to have spirited conversations that were not personal attacks. Step 4, personal coaching. Suppose you've tried team redesign, team coaching, and teaching conflict skills, and you've still got a problem with a certain team member. At that point, you may want to get that person involved with personal coaching to work on specific skills. Let's sum up regarding conflict. Number 1, conflict is a sign of a high-performance team. 2, effective conflict management is a teachable skill. Finally, as a leader, you need to role model the kind of debate you want to have.